Welcome back to the Metro on WDET. I'm Robin Vincent. Overdose deaths have been falling nationally, statewide, and now locally. Last year, at the national level, these kinds of deaths dropped for the first time in 4 years. They decreased by 10%. And in Michigan, overdose deaths decreased by more than 6% 3 years ago. Now, in Dearborn, overdose incidents dropped by 34% 2 years ago. And overdose deaths dropped by 43% over that same time period. While the numbers are trending down, they're still extremely high over the last 2 decades. So how did we get here? And what are the things that are working to lower overdose deaths? To discuss that, we have Ali Abazid with us. He's the founding director of public health and the chief public health officer for the city of Dearborn. Director Abazid, welcome to the Metro.
Thanks, Robin. Great to be with you.
So when you saw these numbers, overdose incidents going down from 93 to 61 over a year's time frame, what was your first reaction?
You know, we had a sense that the numbers were trending downwards. We don't sort of look at the data just once or twice a year. It's an ongoing process in my department and across the city, making data-informed decisions. I think the difference is we saw the trends going in a positive direction, but we wanted to make sure that those were sustainable. And so in the fall, when the federal numbers were announced that there was a sustained decline, that was my first impulse that, okay, this is real. This is happening across the country, but also in Dearborn. And then when we saw the state announce similar declines, I think it shows the power that things don't happen accidentally. And in Dearborn specifically, we, from day one of the launch of this new department and from day one of this administration, set out to make people's lives easier. How do we center those closest to the pain? Those living with opioid use disorder are closest to the pain. And so we set out to launch programs and interventions to make it so that these declines that we're seeing today can happen.
So in other words, this was a very concerted effort. You were not surprised to see the decrease in incidents and deaths.
Well, you know, you work your tail off and sometimes you still don't see progress. And so it's one of those benefits. You know, I was in the federal government prior to this at the NIH, and there you're necessarily sort of 10,000 feet in the air. But when I made the move and we launched this Department of Public Health in Dearborn to do things a little bit differently, to do health differently, I knew that I would sort of be closer to people on the ground. And so when we saw that data, it allowed us to sort of bear the fruits of our labor. But you still, when you're working on such an intractable problem like addiction or substance use disorder, you can try as many programs and interventions and still not see the results. The fact that we are seeing the results in Dearborn is a testament to not just the programs and the interventions, but to telling the story and to reminding those who are living with this disorder that it's not their fault, that this is sort of holding up a mirror to society. Addiction and opioid use disorder is not an individual's fault. There are a lot of societal factors that have led to the malaise that we're in, but what we did in Dearborn is we paired the intervention with the narrative, and I think that's why we're seeing incredibly significant declines.
So not just intervention, but also destigmatizing the problem itself of addiction. Can you talk specifically about what these interventions looked like? I mean, I know that Narcan, which stops overdoses, is a big part of the story in bringing these numbers down. But you've done a lot to actually get into the community, as you have implied here, and meet people where they're at. Talk about that.
Yeah, you know, I like to say we didn't invent Narcan in Dearborn. It's existed. And I think what we did do, though, is we made it accessible in a way that wasn't the norm. One way in which we did that, you know, in the first sort of month on the job, we had a really tragic incident where a young man passed away as a result of an overdose. Every single overdose is preventable, every single one. What made the circumstances around this one especially haunting is that this person was with friends. Friends were fearful. They sort of left him, covered him in blankets because they were afraid of legal consequences. Had they known that the law protects them, had they known or had had Narcan available, that's one more person that would be alive today, a family that wasn't ruptured by the opioid use disorder. But what we did do then, the mayor and I, found that vending machines were becoming trendy across the country, although they haven't become trendy in Michigan. And so in 2022, we launched one in Dearborn. And to date, and I love this number, we've dispensed over 10,000 units of Narcan in Dearborn. Now,
through the vending
machine, which is available now, free. Anyone can go. We don't, it's at the Dearborn train station on Michigan Avenue. Anyone who's listening can go. We'd like to tell people Narcan is kind of like a fire extinguisher. The wrong time to have it is when the house is on fire. And so have it ready and available beforehand. And why I'm so proud of that is because it shows that the public is taking this intervention seriously. And so, yeah, we did make Narcan readily accessible and available to the public. But what we also did through conversations in community is let people know that if you are suffering in silence, you don't need to anymore. We went and talked to our religious community and said, hey, they're going to come to you first. They're not going to come to their government. When they do come to you, though, it's important to talk about faith. It's important to talk about things that you believe in, but also it's important to talk about the science and that we can help save lives here. And I'm really proud that the faith community has really bought into this. Our police department, we launched a co-response model with Access Community Organization where we have licensed counselors going out with police officers whenever there's a mental health incident or an overdose incident.
So this is an effort that you see as something, it must be quite holistic. It needs to involve many different agencies, many different facets of society. And we're going to get into some of those specific agencies that you're working with to make this all happen. But I want to go back to something you said first, which is that every overdose is preventable. Those are some powerful words for us to sit with. What exactly do you mean by that? Do you mean that because Narcan is available, we should never have someone die from an overdose?
That, and also when you think about why people get sort of hooked to begin with, there's this sort of rot in American society that I see from the health perspective, which is we've made this shift over the last 4 decades of blaming individuals for just about everything that they're going through. I mean, it's gotten so dystopian that we even blame people sometimes for the cancers that they're developing. I think that shift to blaming individuals is not accidental. I think when you blame individuals for the things that they're experiencing, including addiction, you shift the burden of blame from larger societal forces. You shift it from pharmaceutical companies. You shift it from the medical providers who have played a significant role in the epidemic, the opioid epidemic. And so for me, it's preventable because we have these life-saving resources like Narcan and other things, but it's also because when we talk about how and why, I think the focus needs to be on truly how and why. Let's talk about the role of multinational corporations who, when profit margins slipped even marginally, pillaged and plundered communities that are living with this sort of malaise. When we talk about, right now in Dearborn, we're getting checks from a lot of people who have settled lawsuits with the federal government for their complicity in the opioid epidemic. Some of those companies are really well-known names. This is all public. CVS, Walgreens, Walmart, McKinsey. McKinsey helped consult pharmaceutical companies on particular communities across the country that are more likely to start using their addictive painkillers. The Sackler family from Purdue Pharma. These are all actors. I believe in blame. I think that we have to assign blame. I think when you just say, these things are, sort of brought on from above and we don't know. No, we do know why. And I think a lot of those larger societal forces played a role in perpetuating the opioid epidemic.
There's no question that, yes, there were these big, stronger forces, certainly the pharmaceutical companies, the healthcare system more broadly, who were playing roles in the opioid epidemic. These were, again, systemic failures. But some people would argue that addiction also has to do with personal responsibility. And I'm sure you've gotten pushback when you make this argument. What do you say to that?
Yeah, I don't buy that. I mean, I think that personal responsibility is a cover for a lot of different sort of bad faith takes. I think that individuals who bear their own responsibility for their own health, that may be true, and that may be something that I believe in. But I think from a framing perspective, I think from a sort of larger, how do we get to the root cause analysis of why this epidemic is happening? I'm more interested in talking about the pharmaceutical companies that spent hundreds of millions of dollars lobbying lawmakers. I'm a lot more interested in talking about, doctors and medical providers who've taken checks from pharmaceutical companies and have gotten, have as a result of that, overly prescribed painkillers to their patients. I'm a lot more interested in talking about how different actors have funded different parts of medical schools and have wiped those textbooks from any of their blame for the opioid epidemic. And so individual responsibility is true. We all bear our responsibility for our own health and our own sort of lives. But the framing of that is what I take issue with. The framing is something that I want to zoom out on and talk about some societal factors that have driven this epidemic.
This is the Metro on WDET. I'm Robin Vincent. We're talking about how Dearborn has significantly brought down its overdose cases and overdose deaths from 2023 to 2024. Our guest is Ali Abazid. He's the founding director of public health and chief public health officer for the city of Dearborn. And we want to hear from you. Have you or someone you know been impacted by addiction? What have you done to help them or yourself through that period? What kinds of assistance do you think people need? Call in and tell us. The number is 313-577-1019. Director Abazid, a lot of drug use is illegal, of course. You have, I think, a more comprehensive view of reducing drug addiction, which you've been outlining for us beyond simply locking people up. But we know the police are tasked with arresting folks for doing and distributing certain drugs. You mentioned you have a relationship with Dearborn Police. How do you work with them to reduce addiction and death from overdoses?
We work very closely with our first responders, the police department, the fire department. They're vital. They're the ones that are sort of being dispatched into the communities. And so shame on me as a public health professional if I wasn't trying to cultivate collaborative lanes with anyone and everyone, including those who are working at the front lines. And so, I mentioned the program that we have in our police department in collaboration with Access, where we have licensed professionals, counselors that are going out with our police officers whenever there's a mental health incident, which includes, overdoses. For me, it's that leads to fewer people arrested and more people that are being met with support, with dignity, and most importantly to me as a public health person, an open door to recovery. My goal as a public health person should be very simple, and to any public health people out there, it should be simple for you too. Save lives. That's it. And so I think, one of the big parts of what we do in Dearborn is we try to sort of root public health back in its origin story, which is, public health began as sort of a radical idea. Different people, based on who they are at different risk of disease. It's really that simple. And so if I'm a public health person and I'm not working really, really hard to make it so that we're meeting people where they are and trying to both support them across their life course so that they're living healthier, more dignified, and also living longer, then shame on me and shame on those of us in public health who don't do that work.
I want to get a little bit more into the why now. Why you think we're dealing with so many overdoses in the first place. And we've talked a little bit about this, about some of the systemic failures that have led to this. But I want to play a clip of a man named Paul Shankin. He works in Oakland County to reduce overdose deaths, and he himself was addicted to drugs for a long time. He joined the Metro a year ago. Here he is talking with our co-host Tia Graham about why drug overdoses have increased.
The prescription medication being overprescribed in the early 2000s, and these are the consequences from that. But that's also a small fraction. Yeah. I'm not saying that's the root cause, but then, like society, finances, personal things, people not having, not knowing how to live life. I mean, really is what it is. Everybody's out here just trying to wing it, trying to figure it out. There's no rule books for this. I mean, there is if you look, but for the most part, most of us just trying to wing it.
Okay, so there's a lot Paul is talking about there. Of course, I know you agree with the problem of pharmaceutical companies pushing drugs and incentivizing doctors. But Paul also talked about people just feeling lost. He said trying to wing it, and that being a cause of addiction. Tell me, what at the city level can officials like yourself do to help people connect to agencies and institutions that can help them feel more rooted? I mean, you did mention earlier the faith community, and that sort of has stuck with me as potentially a place you've been going with this.
I think people can and should look to Dearborn for a lot of things that are happening from a governmental, municipal perspective. And it kind of goes back to my point about, what are you doing the work for? And, we have in Dearborn a mayor who's works his tail off. I mean, it's almost obnoxious how much information he knows and shares in terms of whenever I go with an idea, he already is aware of it. And so I like to remind people that he's a public health mayor. He has training in public health. And so I both have the easiest and toughest job in Dearborn, I think, because one, I never need to convince him, and two, he knows as much, if not more, about public health than I do. And so when I say look to Dearborn, I think it's because we're doing things that governments can do. The power of government is awesome. I think if it weren't, we wouldn't have so many bad faith actors across society who are trying to pillage government to their rotten gains. And so when you're in government, I think I'm a governmental person. I'm an institutionalist. I've been in government at different levels for about a decade now. And it's because I believe in this idea of what do we owe one another? What's the social contract look like? I would hope that people would want things like their water quality, their air quality, different environmental protections in the hands of the public sector, specifically government. It doesn't mean government gets it right all the time. Believe me, it doesn't. It gets it wrong a lot of the time. But I think what we're doing in Dearborn is we're sort of illustrating what it looks like to meet people where they are, but also with the idea of how do we improve your lives daily. Me going to the faith-based community, that's not an easy thing to do, but I did it because public health needs to stop talking to itself. Everyone in public health knows what the ailments are, knows what the root causes are, but we also know what the interventions are. So let's go out there and do hard things. I have a sort of banner right behind me in my office that says we can do hard things. I didn't put that up there because I came up with it randomly one day. I was getting so frustrated with how public health sort of stops because seemingly, well, these are difficult. Yeah, they are difficult problems, but we can also do difficult things. So let's go out and do them. And in Dearborn, we're really doing that.
Director Abazid, you work in government, but you are also among the public health officials who believe that public health really messed up during the COVID pandemic, particularly when it comes to messaging. How did the government get it wrong, and how are you trying to correct that?
Not just the government. And, my friends in public health may sometimes get upset at me for saying this, but I think we have to be honest with ourselves. Public health had a moment, and we dropped the ball. And it's not because we weren't prepared. We had all the information, we had all the data. I was in the federal government during the pandemic. It was that I think we struggled to sort of make our work salient, to make it public, to make it so that people know what their government is. Look, public health is a difficult field. It's a victim of its own success. When it works well, people don't know it. They only hear about public health when things go awry, like the Flint water crisis, or like, pharmaceutical companies flooding the streets with addictive painkillers, or when the baby formula is sort of tainted, which is, a Michigan shame of ours. But I think what public health needs to do is it needs to get over itself, and it needs to stop with this humility. Humility is a private virtue. When you work in public health and government, and you work at the intersection of the two, humility is actually a liability. If you don't talk about what work you're doing in public health, people won't know it. And if they don't know it, then they're not going to support it. And so for me, it's about how do we make this work salient so that people understand that this is something that public health is working on their behalf at all times.
So then you don't necessarily want to see, or you don't buy into that notion that good public health is invisible. You'd rather that it kind of be front and center, that we understand more of its inner workings, because this is something that many of us learned a lot about public health, and we had the word epidemiologist coming out of our mouths a lot during the pandemic. But before that, it was like, I'm not sure a lot of people could have said what the role was of a person directing a public health department.
And we're hoping to illustrate that in Dearborn, and that's by choice. That's not by accident. We are intentional about communicating what we do and how we do it. Because for me, I'm a child of refugees, which means that my family was persecuted for things that they believed in. And for me, the intersection of sort of democracy, human rights, and public health all sort of go into the same cauldron. And so for me, if those of us who believe so strongly in democracy, as I do, want to sort of think about taking another approach to our work, I think a part of that approach has to be that government, but also public health, has to communicate better what we do and how we do it. Data shows that that's likely to increase civic engagement. I know Dr. Mona was on your show last week, and she talked
Dr. Mona Hanna
talking about the RX Kids program, and we were really excited last week. The mayor announced that it's coming to Dearborn. Programs like that, where people feel tangible benefits from both government but also public health, helps increase, their trust and faith in institutions. And I think that that's a good thing, and public health needs to do more of it.
But that's going to take time. I mean, RX Kids, for example, which gives cash to pregnant moms with no restrictions, you see that as having an impact. But that's going to take, 10 to 20 years maybe? And what do you see that impact looking like?
I think we need to plant the trees under whose shade we may or may not benefit from. That's as sort of a core principle of mine in public health. But also, we don't know that that's true or not, whether it's going to take 10 to 20 years, whether it's going to take 2 to 3 years, whether it's going to take 2 to 3 months. I think what Dr. Mona is showing with the RX Kids program is that there's some immediate results that we see in under a year, and we're really hopeful about what that'll do in Dearborn. But I think the other part of public health work is making it so that it's tough to avoid, so that when the water coming through your tap is clean, someone did that. That's public health. When the air that you're breathing and you have COPD or asthma is pure, someone did that. That was public health. Because for me, public health, there's nothing more political than your health. Your zip code tends to be a better predictor of your health than your genetic code. That's not by accident. In Dearborn, South End, for example, which is the asthma epiburden of the state of Michigan, people living with the 4 times the statewide average of asthma, that's not by accident. Certain industries being zoned and planned in those communities, that's not by accident. And so just as those are not accidents, people's health is not an accident. I think that's inherently political, and we bring that work to our we bring that lens to our work every day in Dearborn.
Ali Abazid is the founding director of public health and chief public health officer for the city of Dearborn. Director Abazid, thanks for joining us on the Metro.
Thanks for having me.
Coming up, Health Secretary RFK Jr. has alarmed some autism advocates as he peddles misinformation about autism spectrum disorders. We'll get the facts on autism from a local advocate. And we want to hear from you. What do you wish more people understood about autism? The number is 313-577-1019. This is The Metro on WDET. Stay with us.